Hey, this is Osman. Nationalist movements are using the COVID-19 pandemic to justify deep and structural changes to migrants' rights and border control that go well beyond what is necessary for public health. Limits to social interaction are crucial to stopping the spread of the virus, but these changes are based on irrational racism and prejudice and divert attention from actual issues that need fixing. This needs to be challenged and the lies need to be called out. There are examples of this happening everywhere. In the US, Trump is suspending immigration to the country. He says that this is to help Americans during the pandemic. The order stops green cards from being issued, including to people already inside the country. There is zero connection between the issuing of green cards and the spread of the virus. Immigrants account for 17% of healthcare workers and 24% of direct care workers in the US, and their presence there is crucial to stopping the spread of the virus. There is an obvious lack of leadership. Trump was calling the coronavirus a hoax by late February and delayed making any orders to stop the spread of the virus for weeks. Instead of accepting blame, he's blaming immigrants. In Europe, hard-right movements are using the virus to attack migrants and refugees. In Italy, the government has prevented all migrants from docking at ports, including refugees escaping brutal conditions in Libya, where the UN has reported systematic rape, torture and slavery. In Hungary, the government has abolished the system of asylum entirely. There is zero connection between the right to claim asylum and the spread of the virus. These movements have been demonizing refugees for years, and they're using the virus to justify their hatred. In India, the Hindu fundamentalist government is using the virus to attack Muslims. This has led to fear and hostility across the whole country because the government is blaming a small group of Muslims for spreading the virus. This week, 2 newborn babies died because their mothers were prevented from entering hospital because they were Muslim. One mother was beaten and forced to clean her own blood from the hospital floor. The attempt to demonize migrants and minorities is sickening. These countries all have migrants and minorities working in healthcare, risking their own lives to protect everyone else. We need solidarity with people from all of these backgrounds, especially the most vulnerable. We need understanding and compassion over fear and hostility. And we need to resist any attempts by our governments to demonize them or take away their rights.